Good morning, Dr. Mark here, going through some information to make everybody aware of cardiovascular health, or how to increase the health of our heart, our blood vessels, our circulation, because it is really such an important part of being healthy. And this day and age, what's happening and what's a major issue is that we actually are getting more people with heart issues, high blood pressure, heart attacks, atherosclerosis, blood clots, those sort of things, which really, if we can prevent, we've got to do everything we possibly can to prevent them, because they really do lead to some pretty poor health. And the reason why that is because the body and our tissues needs a good blood supply. If all our cells don't have a good blood supply, they don't have all the oxygen and the nutrients brought to the cells for the cells to function as little engines. And then not only that, cells actually create waste, and that waste needs to be taken away, and it gets taken away by the lymphatic system and circulatory system as well. So blood flow is very, very important. So I'm going to go through a bit of information here on Pycnogenol. Well, Pycnogenol is a purple powder, which I recommend to help with cardiovascular health and other things. We're going to go through some more information now. It's very easy to take. 1 teaspoon within a small cup, 60 mils, that's how we take it. And I'm just going to go through some research now, which has been compiled on how it does help with cardiovascular system, improves heart function. So through these studies, it's quite amazing that it shows how it does help cardiovascular system, the heart to function better, blood pressure normalizes, platelets aren't clumped together as much, so less chance of thrombosis. So many improvements that can actually be made by using it. Now, here is a diagram of a blood vessel. Okay, now so I'm going to go through a research article that shows us how Pycnogenol improves endothelial function. Now, there's going to be some, normally when we go through articles like this on the screen, it's hard to read these. What do I understand? What do I need to take out of that? Most people ask. Well, the summaries, okay? So just summarizing that. Pycnogenol improves endothelial function, meaning endothelial function is the cells which line our blood vessels. So if you see here, I'm just going to get our pointer up. So endothelial cells are the cells lining the interior of a blood vessel. So all our blood vessels which carry our blood, veins and arteries. So if you see these little cells here, that's actually like forming the wall of the blood vessel. And if you can imagine, this is a blood vessel that is a tube, and it's been cut down the tube. Okay, so you can see inside the tube here. So this here is the blood cells, and this is the bloodstream in here. So it's like a pipe. Okay. Now on the outside of the pipe here, we have muscles. It's smooth muscle, which means it is slow twitch, which means it moves very slowly, contracts, relaxes, compared to the fast twitch muscles like our legs or fingers or something which can twitch very, very fast. So smooth muscles are this way, working on our blood vessels to constrict and dilate our blood vessels. Okay. So a perfect example of when our blood vessels are constricted might be in our hands. If we go out into the cold, the blood vessels in our hands will constrict to limit blood flow so that we don't lose heat out of our hands. Likewise, if we get hot again, the blood vessels in our hands will dilate to then allow heat to dissipate out of our skin. Okay, so it flushes the skin with blood. So that's this smooth muscle here working. Now, the common denominator of most cardiovascular risk factors, so most heart risk factors, is the inability of a blood vessel to generate the most important vascular mediator, being nitric oxide. So this is nitric oxide here. And it is produced by the endothelial cells. They basically are stimulated to let it out. Nitric oxide is synthesized by endothelial cells, which line the interior wall of the blood vessels. So these are the blood vessel wall cells, and nitric oxide is let off by these cells. Nitric oxide molecules diffuse through the blood vessel wall to finally interact with a specific receptor in smooth muscle enveloping the vessel. So the nitric oxide stimulates the smooth muscle here, okay? This causes the muscle to relax, and in turn, the vessel lumen increases. So when these muscles relax, so when the muscles on the outside of the vessels relax, the blood vessel becomes wider and carries more blood. Now, keep in mind, blood vessels can be the size of, say, for example, our finger, which might be the main arteries coming out of our heart, or they might be microscopic, which are the blood vessels which are on the tips of our fingers and our toes or in our hands. In our lungs, we have minute blood vessels, microscopic sized blood vessels, which are only the size of one blood cell. So one red blood cell, one of these, some of our cells in our body will only be the size of allowing one of those cells through. Okay, so if they get restricted, no blood can get through them. So very, very important. So this self-regulation mechanism allows for relieving insufficient tissue perfusion and pressure buildup in blood vessels. So what it means that if these muscles can't relax, they can't relax the blood vessel to allow blood to get through, pressure will build up. Furthermore, nitric oxide also acts on blood platelets, so that's this here, to decrease their tendency to form aggregates, which translates to a protection from developing thrombosis. So what it's saying is the nitric oxide that gets released by these endothelial cells also help the platelets not to clot too much, which then means we don't get as many blood clots, etc., which are an issue if we do clot more. In various clinical situations such as hypertension or high blood pressure, atherosclerosis and diabetes, but also with increasing age, the endothelial synthesis of nitric oxide declines. So these cells being able to make this nitric oxide to affect the muscles which dilate the blood vessels, to affect the platelets, to affect other things, decreases, even with age. This results in chronic blood vessel constriction, which impairs blood flow. So more the vessels are constricted, the higher the pressure is and the less blood flow. This elevates blood pressure and increases the risk of thrombosis. Pycnogenol, which is this stuff, activates the enzyme endothelial nitric oxide synthase. Okay, so pycnogenol, endothelial nitric oxide synthase, which acts on the endothelial cells to more efficiently generate nitric oxide. So nitric oxide is generated more from the precursor amino acid L-arginine. So it uses this and oxygen to create more nitric oxide. And it creates it naturally. Okay, so it's not an unnatural increase in nitric oxide. It creates it naturally, so the blood vessels can dilate when they need to, constrict when they need to, platelets can do their correct function, and that's basically what these studies actually show. So what they show is, so this study here is the effect of human medication or pharmacological trial, shows that pycnogenol enhances endothelial function, which is once again, it's the lining of the blood vessels. Now, the effect of pycnogenol on endothelium dependent vasodilation, which is dilation of blood vessels, and blood flow was investigated in a pharmacological investigation with 16 young healthy volunteers in a double-blind placebo-controlled fashion. Endothelium-dependent forearm artery dilatation and corresponding blood flow increase was initiated by infusion of increasing amounts of neurotransmitter acetylcholine, which stimulates activity of the nitric oxide enzyme to enhance generation of nitric oxide. So what it's saying is that in this examination, they tested the vessels in the arm to see how much blood flow they were creating. And what they did is they also gave an infusion or an IV into the bloodstream of acetylcholine. Now, what this does is this normally dilates blood vessels to get increased flow. Okay, so I'm going to just I'll show you that in a second of how that works. But after 2 weeks supplementation with pycnogenol, the endothelium could generate significantly more nitric oxide. So this here is the 2-week mark. To increase forearm blood flow by up to 46%. So this red line here is increase in blood flow just with the IV infusion of acetylcholine, which naturally does that. But what this is showing is that using pycnogenol as well as the acetylcholine increases it by 46%. So it almost doubles the amount of blood flow. This effect of pycnogenol was significant as compared to placebo, which is just the acetylcholine, which did not increase forearm blood flow. Further control experiments used an L-arginine antagonist proved that pycnogenol did indeed enhance vasodilation by stimulation of endothelial nitric oxide synthesis. The result of this pharmacologic study is impressive because it demonstrates enhanced endothelial function response in healthy individuals. Thus, even healthy people will benefit from supplementing with pycnogenol, resulting in better blood flow and tissue perfusion. So what it's basically saying is that it's not interfering with the acetylcholine as we see in this study here. It's actually increasing the amount that the blood vessels can dilate because of the natural release of more nitric oxide into the bloodstream. And that stimulates the endothelial cells, which is the lining of the blood vessels, to dilate more. So in the arm, this test was showing that, yes, there was 46% more blood flow with pycnogenol. Now, that's absolutely fantastic, not only in a person who is healthy, but it's very, very important that a person who is not healthy. So let's imagine that we have someone who has had a high blood pressure for many years. They've got atherosclerosis, they might have diabetes, etc., which affects how the blood vessels carry blood. It actually restricts the blood. If we can get something into those systems, which will create more nitric oxide, which will create more dilation of the blood vessels, we're going to stave off a lot of the issues that we're going to have down the track with regards to decreasing blood flow. But here's another study. So this was showing how pycnogenol improves endothelial function in cardiovascular patients. So for those who have some cardiovascular artery disease, heart, blood pressure, a little bit increased. Okay, so the start of unhealthy heart and circulation. So a double-blind, placebo-controlled crossover study with coronary artery disease patients showed that pycnogenol significantly improved endothelial function, whereas no effect was found with placebo. So we see in the graph here, so all subjects pretty much started around about that 5% mark. You don't see a change in the placebo group. That's not significantly different, 5.4 to 4.7. So we say that's the same. But when we look at the 5% up to 7%, this now starts to become significant, where the flow of the blood in the blood vessels increases because the blood vessels have dilated quite substantially. These patients were under excellent control with medications for blood pressure. So in other words, the medication was working. So that's good. They also had appropriate platelet function, and blood lipid levels were also in normal limits. Patients had blood pressure of 120 on 75, which did not change during the treatment. So blood pressure didn't change, which is good. However, endothelial function improved as pycnogenol was shown to significantly improve flow-mediated vasodilation by 33%, whereas this figure slightly decreased with placebo. Thus, taking pycnogenol as an adjunct to standard medication for cardiovascular disease helps to restore body-owned regulatory mechanisms to improve vascular function. So it is stating, and the writers of this article basically saying that yes, This is something that can be used to help with regards to blood pressure, to keep blood vessels dilated, to keep blood flow as maximum as the body can have it, in extremities, through organ systems, etc. And it's not going to interact with any blood pressure medication. It's going to be totally safe, can be used as part of that as well, I think, which is very positive signs too, because if we can have something that is natural and we can make a medication or something work even better, it then takes out the issue with someone saying, oh, do I need to come off that medication? Or my doctor has said I've got to stay on this medication, or there's no confusion. They both work together. If anything, it complements and helps it work even more. So this here is an isotonic form of pycnogenol. There are many different forms that it can take. It comes in tablets, it comes in pills. It's distributed by many manufacturers around the world. I like to recommend it in an isotonic form, and I'll explain that in a minute, but it's in a powder form. Okay, so this is isotonic OPC-3, and I'll explain that. It is an isotonic capable dietary supplement that reduces free radicals formed in the body. Isotonics OPC-3 delivers a powerful antioxidant punch in an effective isotonic solution that is easily absorbed by the body. Isotonics OPC-3 contains the only isotonic form of pycnogenol in the world. Pycnogenol is a natural plant extract from the bark of the French maritime pine tree and the most clinically researched and potent bioflavonoid. You may have heard that word before in health circles. Grape extracts, also superior sources of OPC-3. Isotonic OPC-3 contains the most bioavailable and potent forms of OPC-3. Bilberry, grapeseed, and pine bark contain bioflavonoids known as anthocyanosides and proanthocyanidins. Big words, but what they mean is antioxidants, which then create in the cells, the blood vessels, body, what we have been speaking about in the research articles that I just went through. These antioxidant compounds are known to be 20 times more powerful than vitamin C and 50 times more powerful than vitamin E in quenching free radicals. So very, very powerful, probably the most powerful that there is. Now, I'd like to talk a little bit about the delivery system, because this is important too, because it is much better to take a powder mixed in water than it is to take a tablet, but then it is much, much better to take an isotonically measured powder mixed in a certain amount of water so that we know exactly what the consistency will be. We know exactly how much we will get into the bloodstream if we take that on an empty stomach. So isotonic means same pressure, bears the name, the same chemical resemblance of the body's blood, plasma, and tears. All fluids in the body have a certain concentration referred to as osmotic pressure. The body's common osmotic pressure, which is isotonic, allows a consistent maintenance of body tissues in order for a substance to be absorbed and used in the body's metabolism. It must be transported in an isotonic state. The isotonic state of the suspension allows nutrients to pass directly into the small intestine and be rapidly absorbed into the bloodstream. The secret of isotonic process is probably now becoming clear. Isotonic dietary supplements are delivered in an isotonic solution. This means that the body has less work to do in obtaining maximum absorption. And this is a diagram of how it actually works in comparison. An isotonic solution, and it might be an isotonic solution of anything. It could be vitamin C. It could be vitamin D. It could be an antioxidant like pycnogenol. It could even be an apple. An apple needs to form into an isotonic clump of tissue or food in the stomach to be absorbed. The stomach doesn't just let through anything into the small intestines. So here we are. If we have the stomach here, and here is the small intestine. Now, point one, when an isotonic solution enters the stomach, it sits in the stomach, and at the base of the stomach here, there are cells or receptors which test the pH or the acidity level of whatever's in the stomach. If it is too acidic, the stomach will then add fluid to it to make it more basic. If it is too basic, the stomach will add more acid to it to level it out, and it will churn it all up. Okay, that's the stomach's role. No digestion is actually done in the stomach. The stomach doesn't actually digest any food. The digestion happens in the small intestines, which is after the stomach. The stomach is only like a cement mixer, which just churns everything up and adds things to it to make it the correct pH for it to be moved through the rest of the digestive system. Now, once the solution is the correct pH, it stimulates the opening of the pyloric valve, smooth muscle contractions, squirt the solution into the small intestine. So it starts to get squirted into the small intestine where absorption takes place or digestion takes place. Now, if we put an isotonic solution into the stomach, an empty stomach, that starts happening immediately. So after the first minute, it's already starting to move into the small intestines, which means that after a very, very short time, 5 minutes maybe, 10 minutes at the maximum, the stomach is empty. All of it has gone through the small intestines, and most of it will be absorbed into the bloodstream and used by the body. Now, let's compare that to a tablet or a capsule or a soft gel or something that has to digest a little bit before it goes through to the small intestines. So here we have the pill enters the stomach that requires digestion. After a minute, it's still waiting to be digested. So none of it is moving through into small intestines or anything like that. Now, as we roll the clock forward, sometimes definitely 5 minutes later, 10 minutes later, 20, 40 minutes later, the tablet is starting to get dissolved. And what's happening is the nutrients within the tablet start to get released into the acid, which is sitting in the stomach. But the stomach's going to be releasing some acid because it says, okay, there's something there that needs to be digested. So I'll need to release some acid there to digest this food. And it's just a tablet. So then the tablet starts breaking down or breaking up, pulls apart, lets all the contents out into the stomach acid, and then it starts the digestive process. But look at how much, and imagine how much of that good nutrients will start to be affected by the stomach acid. The stomach acid is very, very acidic. It's going to actually kill and denature a lot of the nutrients and a lot of good stuff that's actually inside the tablet. So it's not the best. So this is the process just blown up a little bit just to show you a little bit clearer. But what it does allow is that an isotonic solution does allow the body to absorb it more rapidly. It therefore allows for a higher concentration of vitamins and minerals into the bloodstream so the body can use it. And it does achieve maximum results of what we're trying to achieve with whatever it is we're trying to get into the body. So here is as a case in point, if we're trying to get this purple powder, which is a high antioxidant, which help our blood vessels, which will decrease inflammation, which is a very, very powerful antioxidant, and we put it into a tablet, it's not going to get into the bloodstream as effectively as it will in a liquid, and especially not as in an isotonic form, which means like this, which is 1 teaspoon in 60 mils of water. Okay. So, and then when we compare that to a tablet, we get minimal absorption and the nutrients are diluted because it gets denatured in stomach acid. Gets denatured, gets diluted, doesn't work as well. So sometimes when we look at a bottle of vitamins or minerals and we look on there how much is in it, if it's not getting into the bloodstream, well, then it's useless being in the tablet if you can't actually get it into the bloodstream. So here we move on to just a final slide I have on just summing up on pycnogenol, as we've spoken about in these research articles. Okay, pycnogenol is a naturally programmed combination with constant proportions of powerful antioxidants, procyanidins, bioflavonoids, and organic acids, which offer amazing natural properties and multiple health benefits. Now, today I've gone through the how it supports blood vessels, how it dilates blood vessels, how it affects the endothelial cells on our vessel walls. So this is part of this healthy blood circulation component of its properties. There are some others. Got some studies coming up on blood pressure, platelets, cholesterol. So stay posted for those. It also acts as a natural anti-inflammatory. Many research articles on that with regards to decreasing in inflammation. Binds to collagen, elastin, and helps regenerate hyaluronic acid synthase, which is very important with regards to the elasticity, etc. And it is also a powerful antioxidant. So pycnogenol is one of nature's super antioxidants. There are over 420 scientific publications which pycnogenol has been put through, so very extensive, and the research has been done over 40 years. It's one of the world's most researched ingredients, which is very important. It's not new. It's been around for many years. It's just the formulations are getting better, how to deliver it is getting better, and the research is just showing us how it's been working for many years. 160 clinical studies and over 10,000 subjects in these studies. So we've gone through a couple of studies today. I hope that's opened your eyes a little bit to how it can help with blood vessel dilation, circulation. More blood flow will be a healthier outcome. And it's very important when we start to get situations where we decrease blood flow, whether it be through diabetes, whether it be through insufficient blood vessels, whether it be through age as well. We need to keep that blood flow going as much as we possibly can, not only to supply our muscles and our extremities, our organs, etc. But hey, we need to get that blood to our brain. It needs to preserve how our brain actually functions and how it ages, memory, etc. So this is why I recommend pycnogenol to many of my patients. I recommend it on generally those who want to stay healthy and maintain their health. I recommend it because in health, it's good to preserve anyway. I take it every day. I wouldn't miss it. It's an easy way to keep our blood vessels working correctly. And it tastes okay too. Very good. Bye for now, everyone. Have a good day.